asked the crowd at our recent virtual conference called Writers Conference for Healthcare Professionals to share some of their writing, and these are some snippets of what we got.
So this book explores the full spectrum of emotions and experiences that come with having childhood cancer, told firsthand from the perspective of young people with cancer.
It's a compilation of essays from people just like you who are right there in the sandwich generation with all the ups and downs and the joys and heartache of taking care of two different generations of people.
Private practice solution, restoring physician autonomy and reclaiming the doctor-patient relationship, I think is so important because the independent private practice of medicine is needed in order for us to have healthy discussions and move forward in medicine.
For the past couple of years, I have been on the editorial board and an editor for Panhandle Health, which is our local medical journal. This summer is going to be a really fun issue. We've decided to look at the relationship between art and medicine, and I'll be having an article on Alice in Wonderland syndrome.
It does cover my 40-plus years as a freelance writer. We'll share the good, the bad, and the ugly, and success stories and failures, and how you can avoid all my rejections and failures and focus on your own projects as a freelance writer and make as much money as you want.
Basically, if you've ever had a family member or a close friend who became diagnosed with cancer, you know the fear, anxiety, sense of chaos, and general overwhelm that comes with it. This book helps walk patients, family members, and caregivers through step by step what happens when you get a diagnosis and how to manage the journey.
I wrote a book called Anxiety RX, which highlights the error that most of us make when we look at treating anxiety, which is trying to treat the thoughts of the mind, instead of trying to treat the actual root cause of anxiety, which is this old, usually unresolved trauma, usually from childhood.
My book is still in process. It has to do with how a supplement, a common over-the-counter supplement, can wreak havoc with the surgical outcomes.
This book was inspired by my own experience as a physician who was employed for 15 years, and then I transitioned to self-employment about a decade ago.
It is a collection of essays by women physicians. They are nonfiction essays that chronicle the various journeys that women take during their medical careers. Both clinical and non-clinical stories are included.
It is an action-packed urban fantasy adventure filled with spine-chilling suspense and sizzling romance.
Sharing the stories of doctors who are leaving the insurance model and becoming a direct care practice instead.
So I am a co-editor for what we bring to the practice of medicine, perspectives from women physicians.
It's about a medical examiner who uncovers a top secret military experiment when, in the middle of autopsy, a dead soldier awakens.